Standing out as a prominent healthcare provider while being recognized for excellence is certainly an enhancing area and a significant note, being a dominant player in the healthcare industry. Talking Point connects with Mr. Chandika Wijesiriwardana, Executive Director of Medihelp Hospitals. Welcome to the show.
Thanks for having me.
In what ways has your hospital implemented when it comes to innovation in medical practices as well as cutting-edge technologies to definitely enhance the patient care and outcome?
Right. So, healthcare, Sabrina, is a very technology-dependent, technology-driven industry. At least in the past few decades, it has been so, right? So, whatever the equipment that we use, has to be on par with, whatever the latest trends in the global developments as well. So, if you walk into any of our locations and see, any of our diagnostic labs or if our primary care centers, the kind of equipment that we currently use are on par with, whatever that you would see in any other Western country, or whatever all the city hospitals in Colombo as well. So that is one. Whenever we invest in equipment, we always try to go for the latest and the best in the market. In addition, over the past couple of years, we've been investing heavily on our IT infrastructure. So a few of the developments that we've done is one, we are collecting feedbacks from each and every customer. So whoever that comes in and gets a service, maybe diagnostics or consultations or anything else, he'll be getting an opportunity to give us feedback. So we closely monitor that and we see what customers are thinking, and we try to sort of fine tune our product to deliver to the customer's need. In addition, we've recently developed this laboratory information system, so which pretty much takes out any room for human error. So it's sort of end-to-end integrated, barcoded. So all the samples that customers give, until you reach the result, it's fully automated. Right? And customers now have the opportunity to go up to our portal and then check their lab reports and see their history, how the trend has been. So that's something that has added a lot of value for the customers as well. And we've realized this as one of the biggest pain points in healthcare industry. I think not only in Sri Lanka, globally, right, has been the waiting time. Right now, whenever you go to see a consultant or a practitioner, sometimes you might have to wait for a half an hour, 1 hour, 2 hours, or even longer, right? So this is one of the biggest pain points, and it's something that the healthcare industry has been struggling to solve. So we now give the customers the access to live track their appointment. So when the doctor arrives at the hospital, they know the doctor is here, and they can, from their home, they can see what the ongoing number is. So they can just plan their visit, minimizing their waiting time. So that helps us as well. End of the day, that helps us manage capacity better. That makes the life easy for our staff, our operation, as well as it makes the customer's life easier as well. So these investment in technology improvements, IT infrastructure improvement, have obviously given us the edge over the competition as well, in a sense, and it'll hopefully help drive loyalty for customers as well.
Certainly, because this customer care is exactly what they're looking for.
Yes.
How does your hospital chain prioritize when it comes to patients' well-being amidst the challenging healthcare landscape, and what steps has been taken to ensure the higher standards of care as well as safety?
Right. So lately, with the current economic context, what you're seeing is a lot of pressure on the wallet, right? On two ends, on one end on the income, and on the other end on the expenses as well. So their ability to spend is getting is shrinking day by day. So with that, we are seeing a trend in consumers seeking more value for money, right? They are not necessarily looking for the cheapest product in the market, right? But they will always, whenever they spend on a product or a service, they will always see, am I getting the right value for what I'm spending, right? So luckily, we've been, even before any of this happened, we've been always sort of fine-tuning our business model to provide affordable care, right? So we have not necessarily been out there trying to only to cater the top 5% of the market. Our focus has been more the lower middle class, the upper middle class, that kind of market segment. So maybe 40 to 95% of income earners, right? So we've always been looking at ways, in which how can we deliver good quality healthcare, but at an affordable price.
Is that one of the reasons why you have also established branches in the suburbs?
That's correct. So because the kind of clientele that I was talking about is mostly available in the suburbs, right? So our focus has always been on the quality, affordable healthcare. When you look at the healthcare spectrum, on one end you have the city hospitals who are doing a fairly good job in terms of quality, but it is not necessarily affordable for the masses, right? Not always. And on the other end of the spectrum, you have some affordable service providers, but in terms of quality, there can be questions. Of course, I'm sure there are certain service providers who give quality, affordable healthcare, but there's not a lot, right? It is a very small market. So our focus has been always, providing quality healthcare at affordable prices for the masses. So that has kind of helped us sustain with the current economic condition as well, and compete with the rest. So but whenever I say quality affordable healthcare, there is no compromise on quality at any point, because so one of the best testaments to that would be we are now accredited with ISO 15189, which is one of the highest accreditations that you can get for diagnostic laboratories in the world, right? So we are now accredited with that. So you have to go through very stringent processes to ensure and prove that you maintain that kind of quality. So
because you're under scrutiny of some kind of an international body, isn't it?
International body, international as well as local. Yeah. So to cater to the customers in the current context, in the current challenging economic environment, I think we've gotten and fine-tuned our product, right?
Can you share some notable achievements or initiatives that have significantly impacted the healthcare sector in Sri Lanka, distinguishing your hospital chain as a trailblazer in the industry?
So if you look at the landscape, Sabrina, what you will see is all these big city hospitals, right? They are not necessarily geared to cater to primary care requirements, outpatient care requirements, right? If you look at the kind of patients or the customers who walk into their facilities, maybe less than 5% end up getting secondary care, that is getting admitted or getting a surgery done, right? So more than 95% of their customers are coming there for outpatient care services. Could be a consultation, could be diagnostics, could be emergency care, right? So these heavy investments that are made in the center of the city, they are by nature they are not geared to cater to these customers, right? And on the other end, what you have is the service provider who operate in silos. You have standalone GP practices, you have standalone diagnostic players, you have standalone pharmacies, right? Rarely you come across something that puts everything under one roof, right? So what we have done, we have put all these outpatient care services under one roof. So if you walk into any of our primary care centers, what you will see is a comprehensive primary care offering. So you have medical diagnostics, you have the pharmacies, you have 24-hour OPD ETUs, you have X-rays, you have ultrasound scanning, you have specialist consultants from more or less all the specialties. So all the outpatient care services that you need in your locality, right? In your town, you don't have to travel to the city. You don't have to come to Colombo, spending maybe 1-2 hours on the road, spending another few thousands on your vehicle. So it's in your city, and everything is there. So you only have to go out of your locality only for these secondary care facilities. So what we've done is we fine-tuned this business model. I wouldn't say we have got the formula exactly right. We are still trying to understand, what works, what doesn't work, what product mix works, what service mix works in which market. So we are still evolving. But I think to a certain extent, given how everyone else is doing, I think we've gotten it mostly right. So, and we've now placed about 16 of these primary care centers around Colombo suburbs. and in Kalta district as well. We have entered the Gampa district as well. So we've been establishing these primary care centers
in primary towns.
In primary towns, yeah. So in these markets, so that is essentially serving these underserved markets. Before we entered these markets, most of these customers, they either had to go to their standalone GP, standalone diagnostic service provider, and the pharmacies.
Or come to Colombo.
Or come to Colombo to get these services. So now, what we've done, so what we've, as for trailblazing, what we've done is we've taken this primary care model and then copied and pasted, in these cities.
What sort of campaigns did you carry out so that you are clearly marking yourself as trendsetters in this concept of business? Have you done any very sparkling, some kind of campaigns where you were able to touch the minority-based patient
To be honest, we actually haven't. I think we should, right? But what we've done so far is let our product or our service speak for itself. So once you go and establish yourself, and if you satisfy all the customers who walk in through your doors, if you make sure that they get a good service, they will come back. So it's a word of mouth that always takes. That's the strongest way of marketing and taking a message across. So that is what has worked for us. But good suggestion. So we'll think about it in time.
Well, probably maybe because they engage with your service centers and they have already experienced, as you mentioned, superlative
so at the end of the day,
service.
the customer experience, right? No matter how much you spend on the marketing budget, right? If you don't get your product right, if you don't service your customer right, if they walk out unsatisfied,
exactly,
you will not sustain. Right? That's not sustainable in the long term.
Of course, yes. So what are your future plans and strategies for further advancing the healthcare ecosystem in Sri Lanka, and how do you envision your hospital chain's role in shaping the future of healthcare in our island nation?
So in terms of this primary care offering, Sabrina, we have only sort of scratched the surface, right? So the entire country, I'm sure there's an unmet demand, right? There's a lot of underserved markets. So we will definitely look at over the coming couple of years. We'll look at expanding this primary care model, and selectively we will look at markets to offer secondary care as well. Right now also we offer secondary care at 2 of our locations. So selectively we will see where it makes sense, where there is demand, one, and where it makes economic sense to do that, right? So wherever there is demand and wherever there is economic sense to do that, we will look at secondary care as well. So basically the geographic expansion is the main strategy, and then the future expansion strategy. But in addition, we will also look at inorganic growth opportunities. We will look at acquiring if there is promising businesses at reasonable price, at right price. We will look at those opportunities as well, because that's an easy way to enter a market, rather than, because when you enter a new market, it takes a couple of years to reach maturity. So in certain cases, decades, right? So we will look at inorganic growth opportunities, and we will also, in terms of future, we will have to keep a very close eye on how the technology is evolving, because I don't think no longer you can say healthcare is an industry that is going to be there forever, because you've seen at the rate of which the technology is changing. Any industry is at a risk if you don't adjust yourself, if you don't evolve with it, if you try to be a dinosaur, right? You will definitely go extinct, right?
Especially industry of this caliber.
Yeah. So industries like the healthcare, which is very technology dependent, right? So we'll have to keep a close eye on what's happening out there in the world, and align ourselves to make sure that we are out there to grab the opportunity when it comes, and we are ready to face any threats if there are any.
Exactly. What sets your hospital chain apart from competitors, and what are your unique selling points in the healthcare industry?
Right. So certainly, I would say our key unique selling point would be, like I said, quality care at affordable prices, because most of the times what you find is one or the other. It's either good quality, it's either affordable. It's rarely quality and affordable together, right? So one of the unique selling points for us would be quality at affordable price, and given how we are expanding our business, convenience and easy access, right? Because we are always in your locality, in your neighborhood, so it's easy to access and get our services. So those are the main unique selling points that we are focusing on, and we always listen to our customers. We always get their feedback, and we make sure whenever there is a customer who's unsatisfied, we reach out to them. We try to understand better what made them unsatisfied, and try and fix that internally, not only for that customer, right? So when you fix an issue internally, you're fixing that for all of your customers who are going to walk through your doors in days to come. So
in an arena where customer care is being given slightly lower attention, I think that would be your prominence when it comes to aftercare and service, going an extra mile, isn't it?
Certainly, because end of the day, any business that you do, it's your customer who you have to satisfy, and customer is king, right? So that's
not debatable.
That's not debatable, whatever the industry that you're in.
True, true. Amidst the challenging landscape of the healthcare industry, a patient obtaining a service with quality and definitely at an affordable price is definitely a bonus. We were in a very interesting conversation with Mr. Chandika Wijesiriwardana, Executive Director of Medihelp Hospitals. Thank you so much for connecting.
Right. Thanks for inviting me.